Good afternoon, everyone. Welcome to today's webinar. I'm going to give it a couple of minutes as usual to let people join. It's lunchtime session, so appreciate everyone giving up your time this time of day to join us and listen in to our Innovations in NHS Transport and Travel webinar. We do have a great lineup today of speakers, and we're going to start that in just a couple of minutes. We do have quite a few sign-ups, so I just wanted to make sure we get everyone in and settled. We do have a Q&A function, and we also have a chat function. I can't currently see the chat. Here it is. Can people give us a little hello in that chat function that's there today for people to have your own conversations? Thanks, guys. Oh, everyone's saying hello now. Thank you. Thanks, everyone. I did want to make sure that that works. We've got a Q&A function as well. Clive has tested that for us. Thank you, Clive. So the Q&A function is there for questions specifically for our panelists. Chat function is there just for you guys to be having a bit of a chat, giving us feedback, saying hello to each other, typing in responses, thoughts, and anything that you think is relevant. Happy to have that there. If you do have a specific question, please use the Q&A function. So I have them all there separate for the end of the webinar. So we do have quite a few people, and we're a couple of minutes past, so we're going to make a start. So driving sustainability with innovations in the NHS transport and travel. This is a webinar that we run most years. I think we've run it every year since we've run sustainability partnerships, and it's because it's very, very relevant. I think that it always comes up in our January webinar when we have people from the NHS talking about how we can decarbonise the NHS. And I think that in a lot of minds, it's something that's quite low-hanging fruit because it's something that is quite tangible. It's front of mind. It's something that people can see. And I think that transport in general is something that people really have that perception around cutting emissions around. The NHS aims to decarbonise the fleet by 2035. So this is things around transitioning to electric vehicles and promoting sustainable travel options for staff and patients. And we've talked a lot in past sessions as well about how the NHS can't be viewed as this siloed entity that's not embedded within a community, and that's why we have to make sure that we are talking about how people travel to hospitals, and not just patients but obviously the staff and friends and family as well, and how cities need to be thinking about healthcare in terms of it being completely integrated with the public transport and things like that as well, right? So I think that this is, we're very well subscribed for this webinar specifically, and I think it's because a lot of people are quite excited about what we can actually do. I won't go too much onto that because I know we've got Andrew here. He's going to start off, and he's got a lot more to say about it than I do. So Andrew Bradley is the Senior Delivery Lead for Net Zero Travel and Transport at NHS England. So he's the guy with all of the updates about what our priorities are. We're then lucky to be joined by Raj, who's the CTO at Mobile Worker Plus. And then we're going to move on to Mary, who's going to talk from Zedify UK. So I'm going to let Andrew introduce himself, give us a little bit of insight as to what's happening right now, what the priorities are at NHS England. If you do have any questions for Andrew, please use that Q&A function. We'll go through the rest of the other presentations, and then we'll have the Q&A at the end, right at the end of the session. So please hold on until then. But Andrew, I'll let you take over if you want to give us a bit of an intro to yourself. If you want to share your screen and kick us off for today.
Yeah, thank you very much. Can you see my slide?
Where it says that you're starting to share. That's it. Perfect. Take it away.
Perfect. Excellent. Thank you very much. So I'm Andrew Bradley. I'm Senior Delivery Lead for in the Net Zero Travel and Transport team. I'm also Sustainable Travel Lead. So I am interested in anything that will encourage the uptake of more sustainable modes of transport within the NHS. And I'm going to go into a bit of detail about why that's important today, but I'm also going to touch on some of the other things that our team are doing at NHS England and working with NHS trusts and with integrated care boards up and down the country. In short, contents of my presentation, I'm going to touch on the National Net Zero Travel and Transport Strategy, which went live at the very end of October last year. I'm going to talk about shifting journeys to more sustainable travel options. I'm going to talk about transitioning NHS fleets to zero emission, and then I'll bring that all together at the end and hand over to Raj. So why is it important, and why is it that NHS England has decided to focus on this? So apologies if you've seen this before, I'm sure many of you have, but a big chunk of the carbon that's emitted by the NHS is because of or due to travel and transport. You can see broadly there on that chart how it's broken down. The bar on the purple bar on the right hand side gives you the total, but then also it's broken down by its constituent parts and patient transport, the freight transport, and then the staff commute, making up a significant proportion of travel, with business travel falling just behind that. So there's a lot to go at there for us as an NHS. And in our strategy that we launched last October, we included a roadmap which would indicate how we would get to zero emissions for our carbon footprint target by 2040, which is all of the things that we can control directly within our gift, and then for our footprint plus target in 2045, which includes staff commuting and includes patient and visitor travel as well. I just want to highlight three particular points on this roadmap. So the first one is 2026, which is the deadline for all NHS organisations to have a sustainable travel strategy delivered, or developed rather, and incorporated into their green plans. What does that mean? I think it's really important to stress that the NHS trusts and organisations more widely have been working hard on their green plans. But for some of them, when it comes to travel and transport, it's a single page which doesn't really detail how we're going to travel from where we are now to where we need to be. So when we talk about sustainable travel strategies, we're asking trusts to have undertaken staff surveys to understand what it is that staff feel need to be put in place that would encourage them to consider more sustainable travel options, but then also to be working through the art of the possible and to be considering budget that would be allocated to the changes that need to be made. So it's a plan with an action plan contained within it. And then also by 2026, all vehicles offered through the NHS vehicle salary sacrifice schemes will be electric. And we're quite a long way from that at the moment. By 2027, all new vehicles owned or leased by the NHS will be zero emission, and that will exclude ambulances at that point. And by 2033, which is not that long away when we think about it, as a result of increased uptake of active travel, public and shared transport, and the zero emission vehicles that we've talked about, will have reduced staff commuting emissions by 50%. So no mean feat, I hear you cry. In terms of the quantified benefits of the net zero travel and transport strategy, you've got there in that chart a clear picture as to what the impact of going to an electric fleet means in greenhouse gas terms. So it's an annual carbon emission reduction of 70%, and that's based on the existing national grid makeup in terms of the production of electricity. Clearly, as the national grid decarbonises, emissions reductions will increase, but and then also the exhaust air pollution will decrease simultaneously, hand in hand with that. And if we look at the health benefits and societal benefits and annual direct NHS savings, we can see that they are not insignificant in terms of their makeup and their contribution to the NHS, but to society more largely. The fully electrified NHS fleet will require a one-off cost of 100 million or thereabouts in terms of direct investment, but would yield up to 59 million per annum in fuel and maintenance service savings, and that's on the basis of the Treasury's Green Book prices. So actually, we recoup that cost pretty quickly. And also there's the benefits in terms of monetized societal benefits, so benefits to population health, fewer road accidents, etc. So I'm now just going to move on to talk about my pet topic, which is shifting journeys to more sustainable options. So in the NHS, in our strategy, we've adopted the sustainable travel hierarchy, with digital communication being at the top and air travel being at the bottom. Who uses air travel for the NHS? You may ask. Well, actually, there is air travel within the NHS, often associated with the recruitment of new staff from overseas, but actually there's a tiny bit of domestic travel by air as well, and we really want to cut down on that wherever possible. But that's the minority, and I think we've got a lot to go at, frankly, with the walking and wheeling, cycling, public and shared transport, without worrying too much about that at the bottom. So that's what we're aiming to get to, and that's what we're advocating to all NHS organisations, that they consider this and that they adopt this in their sustainable travel strategies. And why is this important? Because staff commuting is massive. We're the UK's largest employer with around 1.5 million staff. We're the 5th largest in the world, and we also account for about 4% of all road traffic in the UK. We came up with one of the UK's largest modal shift networks. My boss thinks it's the largest, but I wasn't sure enough, because there might be somebody who's got another modal shift sustainable travel network, step up a gear. Maybe some of the people on the call are participants in that. We have over 50 individual trusts involved in that network, and that's focused on developing, refining and sharing best practice interventions, and a bespoke evaluation framework built for each individual initiative. It's focused on 4 themes, which are active travel, public transport, car parking and access, and data and technology. And the network will continue until November of this year, at which point we will be undertaking that evaluation to see what we've been able to deliver in the last 2 years when we've been working intensively with the trusts. In terms of staff commuting, this just gives you a flavour for the makeup of staff commuting across the NHS and what modes people are using. You can see the second bar along. London is very different to some of the rest of the country, but it is worth noting that the figures in the rest of the country are a merger of rural and urban areas in those parts of the country. So for instance, in the northwest, 78.9% of people are driving, but in Liverpool or Manchester, you would expect that to be considerably lower. And it just goes to show the potential that we have to go at to try and bolster some of the figures in terms of working from home, in terms of cycling and e-bikes, in terms of public transport and walking. So we've got some midpoint results from our Step Up a Gear network. In terms of Hull, I'll come to first. They managed to achieve between spring 22 and spring 23 a 13.5% reduction in staff commuting on their own in cars. That is massive. And I think most trusts would give their right arm to see a 13.5% swing in a single year. And there were a lot of reasons for that, principally investment in public transport and in cycling facilities and support for cyclists, but also some changes to their parking permit system, not necessarily a reduction in the number of parking permits, but in making the parking permit system more intelligent, so that people could perhaps cycle or take the bus some of the time and drive some other times and not be penalised for doing that. In Birmingham, they've introduced bus taster tickets, which are now increasingly across the whole of the West Midlands, working with National Express West Midlands and with the combined authority there. A 1 week bus ticket was issued to all new starters. That's now been extended to 1 month. It's provided commercially by the operator, and they've seen a 55% transfer to bus ticket purchase. What does that mean? That means that if you sign up in your induction pack for the hospital, you get details of the app that you can sign up to that gets you that 1 month of free travel. At the end of that period, you get the opportunity to purchase a discounted, NHS specific discounted ticket product for the bus. And so that 55% is the conversion from people who've signed up from the for the original free app and then transferred on to actually paying for their bus travel rather than perhaps choosing to drive. In terms of Bart's Hospital in London, they have these excellent Brompton bike lockers that have been installed. Builds on Brompton's Wheels for Heroes programme during the COVID pandemic, which saw 1,500 staff cycling at that trust. The cost of this is £15 per month for 3 months and then £30 per month. So it's a subscription, not prescription. That's me getting NHS. A subscription for that scheme. All 5 docks are now installed at their 5 sites, and they also have included in that discounts for lower banded staff. So those lower banded staff will pay less. And for those not in the know, the NHS is very strict in terms of its pay bands, and clearly for lower banded staff, often signing up to this sort of thing can be a financial issue. So it's to help them. In York, they introduced a network-wide free travel scheme to replace a poorly used park and ride service. And basically that gave free travel for all NHS staff for a limited period on the whole of the first bus network in York. Most of the cost of that was borne by the trust. The trial lasted from June to the end of October 2023, and there was a significant take-up, as you might expect. They've now transitioned to a 50% discount on bus for staff. So for those of you aware that there's a national £2 single fare on most bus services in the UK, or in England, I should say. NHS staff get it in York for £1, and that's now been extended across all of the bus operators in that area. And that is going very nicely indeed and has had a really positive impact on car parking pressures. Business travel, I wanted to just touch on this briefly. In terms of the Leicester Bus Hopper service, they have funded their own service. It's free for NHS staff. Partner organisations build for usage, and the public pay a small fee, and that offsets the cost of running it for the hospital trust, which has 3 massive hospitals on the east, in the centre and on the west of the city. It's cheaper to run this service than to pay the taxi and the grey fleet mileage that the service has replaced. And unlike some other trusts, Leicester have been pretty clear that they've laid on that bus service for staff to use to get from site to site, and they expect staff to use it rather than be using their own vehicles and billing the trust for the pleasure of doing that. And that has a resulting saving for the trust as well. And at Sheffield Children's Hospital, finally, they're committed to supporting staff to cycle for business travel where appropriate and where possible. And what they've done within the NHS, we have a reimbursement scheme for business mileage, whether it be motoring or cycling. They've increased that from 20p per mile, which is the HMRC level, to 40p per mile. And that's tripled the number of cycling miles claimed for under their business travel reimbursement scheme over the past 6 months. And it continues. Briefly, conscious of time, so whizzing through this a little bit. This shows you, this is just a little bit about salary sacrifice schemes for cars. And in terms of those that are limited to ultra low emission vehicles and zero emission vehicles, this is where we are currently. So you can see that there's quite a lot of disparity nationally, but perhaps that reflects where the best electric vehicle infrastructure is currently, with London leading the way on that. I'll just talk a little bit now briefly on transitioning NHS fleets to zero emission vehicles. That gives you a flavour for what the current composition of NHS Trust fleets is. So we're currently at 11%. But the table on the right shows you, or the chart on the right shows you the percentage. So that's ambulance fleets and non-ambulance fleets. It shows you again that we have quite a lot of disparity from place to place nationally. So there is more work to be done in some parts of the country than in others. So in terms of the planning for EV transition and charging infrastructure, we've introduced or we produced a guide for fleet transition and EV charging infrastructure for hospital trusts, which we are really hoping we will get approval to publish very soon on our future NHS workspace, which will be available to all NHS colleagues. It's really important because it addresses some of the frequently asked questions which we get asked all of the time in terms of what charging should we provide, who should it be for, what should it be, rapid charges, should it be trickle charges, what should we provide, and what should the charging, as in the financial charging regime, be? And I think one of the things I would want to say on this call is that we are absolutely not advocating that NHS Trust should be installing chargers for private individuals to charge their cars on NHS sites. We've got enough burden in terms of electrical use and electric demand on sites. For fleets, yes, by all means, and but that should be the priority, charging fleet rather than providing public charging points. And where they are provided, they certainly shouldn't be free of charge for use. The Zero Emission Fleet Transition Tool, this is designed to calculate the total cost and suitability of battery electric vehicles and cars and vans versus internal combustion energy alternatives. So this is freely available at that link, and this I'll circulate this afterwards. So it's well worth you looking at if you haven't got stuck into that at all. So in summary and just in closing, the strategy and milestones are grounded in data and they draw on a broad range of industry and NHS expertise. And we believe also offer a realistic route to mitigating climate change and reducing air pollution. Most of the technology we need to deliver this strategy already exists. So we're not doing something new. This is based on existing infrastructure and existing knowledge. Electric fleets will cost less overall, even when you factor in the investment needed for the charging infrastructure. And a range of tools, case studies, and other supportive resources are already available or will be coming available very soon, including the step-by-step guides, which we referenced there, to help NHS organisations to move forward with this agenda. Lastly, I just want to say there is a gap. We're aware on some of the data that we have around the non-emergency patient transport service fleet collection and also a representative NHS patient travel survey. We are looking to put both of those things right in the current financial year. So I hope that's been helpful, and any questions, please feel free to pose them in the chat. I'll stop sharing.
Thanks, Andrew. Really comprehensive start to conversations, and also quite a positive one as well. So I appreciate you sticking to some of the good news stories there from around the country. We don't always have the most positive things to talk about in these discussions, so we do like to keep it bright as well. Interesting about the sustainable travel strategies that each trust needs to have in place. I think that it's quite interesting that we've gone from every trust having to have a green plan to now actually breaking down those green plans into those different parts. As you say, a lot of them may have kind of polished over the transport piece. It's not really good enough for it to be one page, is it? It's also really interesting that you're including staff surveys in them, because the staff are absolutely integral to the efforts of sustainability across the board, but making sure that their insight is added to this strategy as opposed to it just being a top-down approach is a quite refreshing change to the way that that's actually going to be built out. So really appreciate you sharing that insight. You've obviously really spurred some interest. The slides will be shared, everyone. As usual, this recording will be shared, and the slides will also be shared on the write-up on the Sustainability Partnerships website, which will also be emailed to you. So everyone will definitely get a hold of all that information that Andrew has shared with us today. If you want to share that link, Andrew, in the webinar chat during the session as well, I think people will find that really useful and helpful as well. So there are a couple of questions there for you. We'll answer them after we've gone through the other two presentations. So I'm going to move swiftly on to you, Raj, please. If you can please introduce yourself and tell us a little bit about Mobile Worker Plus and what you guys are doing with Octopass. It's a really interesting scheme, so I'll let you do the talking on that one.
Sorry, I was on mute. Yep. Thanks, Georgia, and thanks, Andrew. Yeah, so my name's Raj Bucktower. I'm the CTO of Mobile Worker Plus, and I'm here today to talk about sustainable car park management, which I think what I'll talk about does dovetail nicely on from Andrew's presentation, as it sort of tackles some of the things that he's been talking about, and in particular, staff commuting. So I'll jump straight into it. Can you all, Georgia, can you see the presentation? Yep. Okay. So, yep, here today to talk about our sustainable car park management solution. A bit about us. Octopass is our digital permit and pass product created by the company Mobile Worker Plus. We were established in 2014. We've got multiple deployments across various sectors, predominantly in healthcare, higher education, and transportation. We are on various frameworks, selling direct and through partners. And our SCPM, Sustainable Car Park Management Capability, was born in 2023 with the aim to help large organisations manage parking permit allocation whilst working towards net zero goals for travel and transport, e.g. decarbonising staff commuting. Right, so this slide was born from attending and sitting on various healthcare special interest groups and forums and talking to a lot of trusts. So what you see here is just me collecting some of the challenges that were discussed, this year, last year. So achieving net zero for travel and transport as per NHS England guidelines, we've just heard from Andrew. Balancing parking permits issued with available parking bays. And, it is a sensitive subject requiring careful handling because, it's quite easy for people to get in their cars and drive to work. In the NHS, people work long hours, it's a long day and, just want to get in the car and go home at the end of the shift. The table, limited spaces. I think NHS trusts know that. They've got, limited spaces and more people that want to park. Losing spaces, I heard from a few trusts losing car park space to build healthcare units to sort of meet the demand for healthcare services. Shift work, it's not, in the NHS, it's not a 9 till 5 sort of everybody starts and ends at the same time. So it's very complex in itself. Security concerns, parking your car. You might consider, the safety of leaving your car on certain sites or even walking to your car, at unsocial hours. Complex parking needs. I think in healthcare, the criteria for parking is quite complex. Balancing patients and visitors and staff needs. Andrew talked previously about the percentage number of car park space that is used by staff versus visitors and patients. Financial procurement constraints, I'm sure a lot of you know about. Administrative overheads in managing parking permits for staff. It is quite labour intensive, or can be. The lack of alternate transport options. The environmental and net zero goals. Well, we just heard from Andrew on all that. So the regulatory and compliance side of things. Well, net zero, data protection, security. And the other thing that was mentioned is handling a rapid change. So, if there are changes in parking policies, which then change the types of permits that you offer, especially where we've seen post-COVID a shift from 5 days a week in the office or in on site to sort of more hybrid working, being able to adapt and be agile to sort of manage parking along with that. But this slide is what our permit solution sort of offers, and what I put here is we take it a step further by introducing the sustainability. So a lot of permit management solutions out there with all sorts of vendors, they all flexible permit types, annual permits, day passes, pay as you go, so on and so on. Customizable permit application forms where you can add all fields to build an application form for a permit, and so on and so on. Single sign-on, we integrate to all your existing systems. Access control, integrating with ANPR barriers, permit approval, automatic bulk, etc., etc. But so what I've got here, we've got eligibility criteria and scoring, sustainable travel option scoring. So during the permit application process, we will score your sustainable travel, which I'll show in the next slides. Creating personal travel plans, car sharing permits. So that's what I mean by taking a step further. We believe we are one of the very few sort of suppliers out there looking at sustainability as part of managing parking permits. So here we go. So introducing car park management and sustainability. So we help organisations manage staff parking whilst working towards net zero goals. And emphasis on the whilst, because to target 2023, I think Andrew just put on his presentation. We help organisations align their permit management with their strategic travel plans to meet KPIs, reducing single occupancy journeys, KPIs for vehicle congestion and vehicle emission. And it was pleasing to see, for example, at Hull, staff commuting has dropped by 13% from memory, and increase in sort of percentages of using alternate transport. So we integrate permit allocation with sustainable travel options and personal behaviour during the application process. And the idea behind it, we incentivise and encourage behaviour change and promote efficient parking management with eco-friendly commuting habits. You might ask how that works. So in the permit application process, you'll start by creating a personal travel plan from your home location to site, where you'll be presented with your sustainable travel options during that process. And what we do that's different, we actually score those travel options and used in conjunction with your eligibility scoring, and a lot of trusts have eligibility criteria. That information is then used to, you can use it to approve and reject permits. And then permits are only allocated to those who sort of meet required criteria. And alongside that, we have support for electric vehicle permits, car share permits, park and ride permits. When I say park and ride, it's, if the trust has or healthcare institution has a car park that's perhaps slightly outside, away from a congested town, park there. We work with BPL on their Park Active scheme, and then you may have other options like a shuttle bus or a cycle or walk, the rest of your journey. We also have hybrid working permits, flexible working permits for people who work, they don't necessarily work on site every day of the week, or they work across sites. That diagram just essentially shows a bit of a workflow of that. Here we are. Here's an example of a personal travel plan of someone going from A to B. So they'll put that in, and then they'll be presented with their travel options. You can see the icons on the left: walking, cycling, car sharing, public transport. Click on those, and you're presented with all the information you need, the times, etc., etc. And on the right, there'll be a button or a link. Click here if you want to continue and apply for your parking permit. Permit application form. I'm not going to go too much into that because the emphasis here is about sustainability. But different types of permits and passes, very customizable application forms, eligibility questions, documentary evidence uploads, the eligibility and sustainability scoring, which I'll show another slide on, exclusion zones, so you can adopt anyone living within 2 or 3 miles of the site may not get a parking permit. Then we've got various sort of methods of approval: line manager approval, manual, automatic, bulk approval, multiple payment charge. There's a lot more I can talk about that, but that probably for another discussion. Right, here we go. So this is how the sustainability scoring is integrated into the permit application. So once you've made your application, your sustainable travel options are scored. And if you see the little box in the middle, you can see a sustainability score of 75. Drive options, park and ride, so walking, public transport, so on and so on. And we have an algorithm that scores that. And it's then presented to the administration team as a sustainability score alongside your eligibility score, and in conjunction you can use that to either automatically, you can see there's an approve button, anybody with a score above 75 or 200 or whatever automatically may get rejected because they have other means to get to work. So I hope that's sort of self-explanatory there. So how can Octopass, how can we help to meet sustainability goals? Well, I'm hoping that through integrating sustainability into the permit application process, the concept is to reduce vehicle emissions and congestion around site, getting to site, reduce the number of single occupancy car journeys to work. For example, if you're not eligible for a car parking permit, you may decide, well, I'll look at the lift share option. Managing parking demand by only allocating permits to those that meet eligibility. You can also manage your allocation limits to control over subscription. Eliminate paper waste with digital permits. I still speak to trusts who are printing permits and putting them on dashboard. No, paper. We should move away from paper, but the overhead in time and of just using paper, etc. Adopting exclusion zones and public travel time thresholds. For example, if you live within a 45-minute journey to work on public transport, then perhaps there are policies, well, you're not going to get a permit. Encourage behaviour change, promoting active travel. And I'm hoping that customers, healthcare institutions can benefit by, and I've underlined it, thinking differently about parking management, which ultimately delivers better policy, compliance, and positive change. Moving on. Oh, yeah. So SCPM has been shortlisted for an award at ParkX, which is on right now in Coventry. And in a few hours, I've got to do a 5-minute presentation to a panel of judges and a live audience, sort of Britain's Got Talent style. And if you are in the Coventry area, you're coming to ParkX today. We're at P99. Stand P99, that is. Oh, and that's it. Yeah. So here's our get in touch details. And I'm done, everyone. So thanks a lot for listening. I'll stop sharing and I will put my details in the chat if anyone wants to get in touch.
Thanks so much for that, Raj. And didn't realise you were such a busy man today. We've taken you away from your stand P99, was it?
P99, and I've got to
taking you away from this
present for
if
5
anyone
minutes.
is there, obviously go and see Raj, and obviously good luck for this afternoon as well. We do have some questions in for you. Again, if we can put questions in Q&A and not in the chat, otherwise I might lose them in there as people keep adding comments and things. We'll move on to you, Mary, and you can give us an intro to what you guys do, and then we'll move into the Q&A straight after that presentation.
Yeah, lovely. Thanks, Georgia. I'll just share my presentation with you if you bear with me. Hopefully you can see that. So I'm here today, Group Partnerships for Zedify. We currently work with the NHS in different forms, but I'm also really here to sort of champion cargo bikes there's a lot of great independent cargo bike companies in the UK doing some great things for the NHS, government and local businesses. It may inspire you to have your own fleet of cargo bikes, so you don't need to use a courier like ourselves. You may decide to buy a cargo bike and keep it in-house and use it as part of your facilities in hospitals. But a lot of people don't know what cargo bikes are about. So that's what I'm here today to sort of show really how cargo bikes can help reduce mainly Scope 3 emissions and help the NHS get to that net zero target. So who are Zedify? We are actually the largest cargo bike courier in the UK, and that we're currently in 9 cities. And you can see that there with the white dots, soon to be in Birmingham. And we have a sort of a plan to grow our business across all major cities in the UK in the next few years. These are sort of decided by customer needs, but it can also be perhaps local government authorities have asked us to come to a city that has really got a sustainable focus. You see there's other cargo bike couriers around the UK, but what do these all have in common? Well, basically, it's the air quality. You know, delivering parcels do need to change. Poor air quality, as a lot of people on this call probably know, it's costing the NHS millions. Actually, last recorded stat, and you can see there, in 2017, it was estimated £157 million. But if left as is, forecasts are saying it could be in the billions, 18.5 billion by 2035. And not only does it have a financial cost, but they're saying last figures were about 40,000 premature deaths are caused by emissions, not only carbon dioxide, but the particulates in NO2 that's released from the vehicles themselves. So what are people doing? They are actually moving from diesel to electric. And electric is good. You know, we have a few electric vans in our fleet as well, but 39% of vans in the cities are less than a quarter full. And that's according to Transport for London survey in 2022. So what we're really about is, and all the cargo bike couriers are about, is using the right size of vehicle for the right job. So not only do we want to get rid of diesel vehicles and the nasty emissions that go with that, but also to take congestion off our streets. We've always had a mantra that it's better deliveries for better cities. Not only does it reduce emissions, but also healthier places to live can help with people's mental health, which is all about the NHS as well, sort of not only looking after the environment, but looking after the people that they serve. So as well as the pollution, congestion is this major problem, and we can see that recent studies say that cargo bikes can deliver 60% more efficiently than vans, and that's because we can access cycling networks, we can access low emission zones, low traffic neighbourhoods, pedestrian areas. And I'll send a link. We've actually got a great video by one of our cyclists in Bristol on his daily round. And you look at that and you can quickly see how utilising the cycling network, it can move around the city much quicker than the vans, electric and diesel. So I'll share that with my presentation later. So what are all these stats that we're talking about? I said we've got our impact report for 2023, and last year, Zedify ourselves, we saved 202 tonnes of CO2 from entering the environment. If you break it down, most people look at per delivery, and that's per parcel, per kilometre compared to a diesel and an electric van. And what we've started to look at is the embodied emissions. So not only what's at the tailpipe, but also what does it actually take to create and build these diesel vans, electric vans and cargo bikes. The battery in an electric van is much bigger, takes a lot more resources to build a battery for an electric van compared to a small electric bike or trike. And so we've actually started calling it well to wheels, looking at digging up the diesel, manufacturing the cars or the vans, getting them on the road, and how many journeys does it take for it actually to offset itself. And we can see, I'll share that in the links there at the bottom. It'll be in an impact report. We have been very honest and open about where we're getting our facts and figures from, especially in our own journeys. Oh, bear with me. So one of the good things actually coming on today as well is we had actually been awarded an NHS framework as part of the Shared Businesses Service Framework Agreement. So it is looking at sustainable travel. So car parks, charging, even consultancy services are all part of that framework. And one section that we are involved in is Lot 4, which is low carbon deliveries. And we're only one of 2 cargo bike couriers that are in there. And really, what is cargo bikes good for? Well, cargo bikes can be used for a lot of different uses. You know, we can go from a file to a filing cabinet. We can go from a pen to a pallet, basically. Our largest cargo bike can carry up to 200 kilos in a box that is over 1 metre square. So it's really when you start looking at all the different uses out there, what can we actually do? All over the UK, there's cargo bikes delivering prescriptions for local pharmacies. We're delivering dental labs, treatments. One of the things we did for the University of Glasgow in the hospital there was delivering lab specimens during COVID. Actually, it was time-sensitive deliveries from the universities in Glasgow to the Queen Elizabeth Hospital, and due to the sort of cycling infrastructure, which is quite good in Glasgow, we managed to do that fairly well. Not only just ourselves, as I say, there's some great companies out there. Charlton Bike Deliveries, and actually a business that we partner with in Manchester, and they've been doing some great stuff with the University Foundation Trust there, delivering from GP surgeries in local hospitals all over Manchester, back and forward a couple of times a day, and taking files back and forward. And see, there's a lovely quote there from the facilities manager who initially came to reduce the impact, but he's obviously stayed with Charlton Bike Deliveries for the standard of service that he receives. Pedal and Post, they're another great business in Oxford, who actually, the agreement is not with the hospital themselves, but for the hospitals through Baxter Healthcare. And what they were finding is they've got to deliver urgent chemotherapy drugs and other medicines for these treatments to the patients fresh each morning. And you can imagine how the patients are feeling if treatment is delayed because a courier is caught up in traffic. So what they have done is they moved from the vans to cargo bikes, going back and forward to the Baxter Healthcare a number of times a day. What they actually found was a real 50% reduction in time taken to get to the hospitals from Baxter, and really positive. The number of amount of carbon they actually saved in 1 year. There was 51,000 deliveries, and of that, an estimated 10 tonnes of carbon saved just from that one particular contract. Pedal and Post, a forward-thinking cargo bike courier, have now linked up with the trains to deliver items collected by bike in Oxford on the electric trains down to London and delivered in London at the other end. So these are sort of ways that we're looking to sort of expand our services. Cargo bikes come in a lot of range of different sizes, and they're cheaper than electric vehicles, a lot cheaper, with bikes been in the single figure thousands compared to tens of thousands, cheaper to run, and obviously cheaper and quicker to charge. ABCAM is one of our long-standing clients in Cambridge. Actually, they've been with us nearly 10 years, and they're one of the sort of world's sort of leading supply and lab specimens globally, as well as in the UK. And what we've been doing with them is delivering for over 10 years. We do an average of 2,500 deliveries each year in Cambridge, and even that volume we saved about 508 kilos of carbon as well into the environment. And so, sorry, I might have speeded through that, but I hope that sort of just gives you an idea or a flavour of what cargo bikes can do. There's a lot of hospitals that I speak to, NHS trusts, where actually taxis can be the default courier of choice. They can't use a traditional courier. They want something delivered quickly. They're looking at taxis. I know that's the case in Glasgow. It's actually one of the largest couriers out there, although they're not an actual courier company. So it's just looking at, what do you currently do at the moment? Do you use a taxi? Do you use an internal van? Do you use Royal Mail? Do you use DPD? All these things can actually be done with a cargo bike courier, taking all those emissions out of the environment. They say electric vans are great, but cargo bikes is the best option, and to help everybody reach those net zero goals in your green agenda. And that's it from myself. Thanks, Georgia.
Thanks, Mary. Really appreciate the insight into what you guys are doing at Zedify. Excited that you're going to be in Leeds soon. If everyone doesn't know, that's where we are based, Sustainability Partnerships. We're in Leeds. Don't envy the guys having to cycle up and down in Edinburgh, though. I wouldn't want to be the one going up the Royal Mile on a bike. But yeah, thanks. I mean, Andrew, did you already know about what they were doing at Zedify? Are you aware of what the cargo bike revolution?
Yeah, a little bit. I mean, if I'm honest, my focus has very much been on people rather than things, the transport of people. But I would be really keen to have a further discussion with you, Mary, about how you're involved with the NHS, so that we can sort of highlight some of that a bit more through our channels.
Yeah,
that would be great.
Yeah, lovely, Andrew.
One of the points that I read there that you didn't articulate specifically was around the temperature sensitive piece as well. So obviously cold chain logistics is something that is absolutely critical to a lot of things, not just drugs, but obviously human tissue as well. So that's something that I think obviously is quite specialist and hopefully of interest to some of the people on this call as well. So I'm going to go into some of the questions that we've had. Now, this is one, Andrew, I think for you, and it's one that comes up quite often, and it's a debate that's ongoing. I don't have the answer. I don't know if you have the answer, but you might have some thoughts on it. And it's around, you know, one side saying let's transition everything to EVs, and the other side saying, hey, well, let's make sure that all of the vehicles that we're using or leasing or own, you know, go through their full life cycle before actually changing that over to an EV. What are your thoughts on that debate?
Yeah, it is a valid point in terms of the full life cycle of vehicles. But even with petrol and diesel leased vehicles, they generally don't stay at an organisation where the leasing company want to move them on, and they move them onto the private market for sale after a given period, because they don't want to be lumbered with the maintenance of older vehicles and for the depreciation of the vehicle to carry on too long. I think the EV market particularly is an interesting one, because if you look at your Nissan Leafs of 10 years ago, their range was so much lower than what we're seeing now. So we are in a period of rapid development, and that's quite tricky. There's no getting away from that. But in terms of the lease setup, I think there is a paucity of EVs in the second-hand private vehicle sales market at the moment, and there is a lot of demand. So in terms of us using through our leasing schemes, bringing EVs through, I don't think that's a particular problem that I see at the minute. I do get the point, but it's not as if all of the vehicles are getting scrapped tomorrow.
Yeah. And another question as well around rural areas, which again is something that's, I guess, why a lot of the green plans are quite different in terms of their sustainable travel strategies, because some are, trusts within a sprawling urban area, and some are very quite disparate. So there's a question here around what progress that you're finding in rural areas in terms of encouraging reduction of staff travel by car, where the public transport can be quite poor.
Yeah, there's horses for courses. And if you've got no bus service, and let's face it, bus service has been slashed massively in the last 15 years, and COVID didn't help. So absolutely, if it's a major rural area that has really poor public transport services, then the car is going to be the solution, and we accept that. We're definitely not advocating that public transport, walking and cycling are the right solution in every space, because in some spaces that's just simply not possible, just as it isn't for patients to get from point to point. What we are doing is we're working quite closely now with the Department for Transport, and through their Rural Mobility Fund, they funded quite a significant number of demand responsive transport solutions, in various parts of the country and largely in rural areas. So we're working with various trusts, ICBs, integrated care boards, and county councils now to see how we can progress that and engage what they're doing with what we're doing, to sort of join the dots on that. And also, because often demand responsive transport solutions fail because they are so expensive. They're brought in, and then 2 or 3 years later the money runs out and they're removed. Now, if we can provide solutions for, or provide reasons for them to make journeys with passengers, then that's all to the good. So we've got conversations ongoing at the moment with Surrey and Essex, and really keen to reach out to other parts of the country as well on
that. Raj, we've got a question, or maybe just a comment to you about the fact that Andy's mentioned here that ambulance trusts provide free parking for staff, and have you considered Octopus for tapping into the ambulance sector? Did you know about this?
Kind of. So we talk to a lot of trusts. We engage with a lot of trusts. But we haven't specifically spoken to ambulance trusts, but we're very interested to. I probably want to understand what the problems are. Is it a case of is it quite common that they don't have enough parking spaces for ambulance staff? Therefore, they need to look at helping with getting people to. I'm not sure what they call the ambulance stations, or their units, their offices, and so on and so on. So yeah, be very interested to do that if it is a problem that warrants.
I think Andrew might have insight. Did you get your hand up there?
Yeah. Just very briefly, Raj, to give you an example, the Yorkshire Ambulance Service head offices in Wakefield, it's not a public site where people are visiting. So the ambulance trusts have their sort of own. They're more of a kind of, I guess, almost like a standard business where you wouldn't, if you've got a warehouse or you've got a call center or what have you. And in most ambulance service headquarters, they've got both. They've got engineering sheds. They've also got the 999 and 101 call centers. And so there's a lot of staff coming into them. Quite often, they have no parking permit solution at all, because they don't have that sort of public patients and staff problem that they have to address. And it's quite difficult to recruit and retain staff. But, I think Andy is right. It is something that is possibly worth looking at.
Yeah, well, I'll talk to via email. If happy to talk to Ambulance Trust to understand their problems and how we can help. I'm not aware of the bigger sort of units, but the one near me is a small building where I could just see a number of bays around the building where the ambulances sort of come from. So if it's a big enough problem that warrants help, we're very interested to talk to them.
Right. Some particular insight. We are running out of time, and I know that some people are having to come off, but there are a couple of questions for you, Mary. I'm just going to rattle two of them off for you real quick for you to just give us quick fire answers if you can. One of them is in relation to the cold chain stuff that I mentioned earlier, and if you monitor temperatures during transit. I know there's a lot of great real-time monitoring solutions out there. And then also someone's asking if the bikes, are they suitable for dual carriageways and motorways and things, or is it just in local areas? So if you can quick fire answer those two for us, that'd be great.
Sure. We have done some testing on items in cold chain, actually taken some temperature devices with us to measure it at the start and at the end of the journey and make sure it sort of stays within the legal limits. The bikes themselves are not refrigerated, but the packaging, the dry ice, the thermal boxes inside, everything there is usually as it should be, especially dealing with the NHS, everything is sort of agreed and supervised with the hospitals as well to make sure we're using the right packaging. With motorways and dual carriageways, I believe we can legally go on a dual carriageway. They are electric assisted bikes, so that does help with the hills of Edinburgh, actually. But, there's lots of great cycling infrastructure out there, and we try and plan our route so that we'd probably avoid these if we can, but if need be, we will go round or over. Motorways, I'm not aware that we've went on any motorways at all, actually.
Okay. So it is generally, I guess, with those trusts more that have great, I guess the better the cycle routes and things within cities, the more easily you guys are going to get around.
Yes, exactly. There's a lot of great paths, even if you think about Edinburgh, it's quite flat. There's the canal, you can go right from one end of the town to the other and cut out most of the traffic on the way as well. So, I think we're very well suited. If anybody would like to say, we've got some videos on our Instagram page sort of demonstrating what our bikes are capable of. Sure, there's a lot of other companies out there that are doing exactly the same.
All right, great. Well, we have run out of time, unfortunately, and we do have a lot of people dropping off because we do always promise the hour and we're over already. I mean, this always happens, but we'll have to just deal with that. So a couple of things from me. I hope that everyone is aware that on the 20th of June is the Sustainability Day of Action. It's our flagship event. We do this every single year. We have 4 webinars that day, one on clean air, one on sustainable food options, one first thing in the morning about supply chains, and then we have one about creating conversations and communication strategies for sustainable comms within the NHS is our 4 for that day. So please, they are now live on the website. Please, someone's just added already the link to that from my team. So if you are interested, please go and sign up to those. We also have a brand new page on our website called Working with the NHS. So if you want to be in Mary or Raj's shoes next time, or you want to run your own webinar with us, if you want to run an email campaign or social media or content with sustainability partnerships, we do have a page now live on our website that our team has just posted here. Please get in touch with us to talk about how you might be involved involved in collaborating with us on our next online event or on-site content. And as for today, thank you so much to Andrew for your great insight. A lot of people are asking for your slides, so they will be shared. Your great insight into what's happening and what the priorities are within the NHS England right now. To Raj for opening up everyone's eyes to how we can be a little bit more sustainable when it comes to our parking permits solutions, and to Mary for everything that's happening at Zedify. Really excited to see you moving out across those different cities across the country. Mary, we'll maybe catch up with you again this time next year on our transport webinar and see how you've conquered the rest of the UK with your cargo bikes. I think that it's such an important potential for really reducing that down. I can't believe people are using taxis. I know I did already know this, but it's always crazy when I hear it. The town is just full of cabs going around with for the NHS. So thanks everyone for joining today. Everyone's having to leave now, so appreciate everyone staying as long as you possibly could. Please sign up for the Sustainability Day of Action. There's going to be some really, really insightful webinars on that day, and I'll hopefully stay ready for the entire day, because it's going to be a long one for me, but it's super important. Thank you to Andrew, Raj, and Mary again, and to everyone today, and we'll see you next time at Sustainability Day of Action.